Good evening, and welcome again to Public Perspective. I'm your host, Kevin McDermott, and tonight we'll be turning to a subject of wellness and what it means to be well and how to get well. Our guest tonight is Penny Block. She's the Executive Director of the Block Cancer Center. So, Penny, welcome to the show. And did I get that right? Is it the Block Cancer Center or the Block Cancer
Close enough. It's the Block Center for Integrative Cancer Treatment.
Yes.
But also and optimal health.
So, as long as we've corrected the title, let's talk about integrative treatment and what the word integrative means, how the Block Center handles it, and how it's interpreted elsewhere as well. So what does it mean to the Block Center to do integrative care?
Well, may I go back just a little bit and explain
Sure.
that Keith Block, my husband, MD Keith Block, and I officially opened the doors to the Block Center back in June of 1980. So we've gone through a lot of changes, but there are certain principles. And partly because of our own medical experience, we realized that conventional medicine in and of itself was necessary but not sufficient. So that's where it starts. And we know that adding systematically adding and combining certain components like diet and appropriate physical exercise or physical activity and biobehavioral techniques, and then supplemental compounds that are carefully formulated and produced, can actually create better effect in medicine. So it's not like an add-on. And there are many places that tend to label themselves integrative, and in some ways, in the past 33 years, we've watched the growing number of them. And in some ways, it's encouraging because it does reflect a change in medical thinking, medical practice, but most importantly, in change in the expectations of patients.
Well, what led you and your husband to think about this initially 33 years ago, or prior to that, certainly, because you thought about this for a while before opening the clinic?
Right.
What led you guys down this path?
Personal stories?
Sure.
All right. I don't want to eat up all the minutes here, so you get to cut me off. I won't be offended. But anyway, for me, I had, as a very young woman, fit, athletic, healthy, seemingly, fainted on a bus going to work, fainted the next day going to work, and so, of course, my family said, get thee to a doctor. And I went to a really nice internal medicine doc who did all the traditional tests. And then we had a very thoughtful consultation. At the end of the consultation, he stood up and he shook my right hand vigorously and said, Penny, you're the picture of health. But in my left hand, he gave me 3 prescriptions. Picture of health, 3 prescriptions. So I realized we had a really, for me, unclear
Mixed
definition
message,
or conceptualization of health. So I began by redefining in my own mind what health is. And I realized that it is more than just the absence. That was a negative conceptualization of the absence of a significant diagnosis or the absence of severe symptoms. Those are prerequisite to health, but they are not synonymous with health. And for me, I realized that health, and you know, I've said this many times, so I hope it doesn't sound canned, but health is really what we all want, and being able to engage in our lives with the greatest vitality possible in every dimension of our being. And the neat thing is, all those dimensions of our being, from the gene expression to the biochemical to the biobehavioral, are interconnected dynamically. And that interconnection can be used to produce health. So I actually, going back, before I recognized some of the things I just mentioned, I was going to open what was called a holistic health center. And I had a Chinese herbalist and a Chinese acupuncturist, and they are 2 specialties, you know, in traditional Chinese medicine. I had a European herbalist, and I had body workers. And then I went to this weekend meditation retreat and met this really smart, maverick, visionary young medical student whose name is Keith Block, and as they say, the rest is history. Keith writes about his own experience in medicine, a bleeding ulcer in medical school, trying many diets and other health sort of regimens, and finding one that actually worked, because he wasn't real pleased about what was offered him, which was one surgery and then possibly a neck surgery. So we came together and developed a program that people could do themselves to help engender good health, and realized it would be dishonest for us to just hide our heads in the sand and say, well, wait a minute, you know, we are going to be able to eat our way to good health.
Well, and that's not the message either, that it's just...
So that's what happened. We recognized that there was a false dichotomy between what was considered conventional medicine and at the time what we did was considered alternative. It is not alternative. And we found there's a way to bring them together in a systematic way so they're mutually enhancing. I have to say, though, that going back is there are a lot of places that label themselves integrative, but what they really do is they add on some nice little complementary practices or interventions, yoga here, and yoga's great, but yoga or something else down the hall, and then they can market themselves as integrative. And I don't mean to denigrate them because at least they're responding to patient demand, but it's not sufficient. So we really combine all these modalities together, and we've gotten more and more precise at matching what we recommend to what each individual needs. And at each, if you will, point or juncture along this whole path to health recovery, because it changes. So we do, when someone walks in the door, we do a whole series of labs to know what someone's biochemical terrain factors, meaning what's inflammatory level, what is insulin dysregulation, oxidative stress, immune levels and status, etc. So those are factors that are really relevant to health or disease. And so we're able to then develop a regimen or a plan for that person, even just in terms of their supplements, that matches what that person needs, and then go back and look at it and say, are we hitting the mark? Rather than just doing sort of the kitchen sink approach.
So how did you, well, actually, first I have a quick question. When the doctor said you're the picture of health and handed you those 3 prescriptions, what did you do? Did you take them? Did you throw it away?
Well, I was so puzzled. You know, he was a nice, recommended, highly respected doctor, and I didn't like fainting.
Not surprisingly.
But, you know, later I have found that when I made changes that were lifestyle changes, I have to tell you that I'm pleased to say, and I'm probably afraid to say it because I don't want to jinx anything, but I've never had that experience again.
Now, you made changes as a result of that early episode,
I absolutely did. Absolutely. And then, of course, when I met Keith, we started developing a more carefully designed plan in terms of dietary. And if you want, I can explain what some of the general guidelines are of diet.
Well, before we get to that, I'm curious about how you developed it, because at the time it sounds as though...
Oh, it was hard.
Yes, you and your husband Keith were in terra incognita.
It was.
And so there weren't guidelines about how to determine what really was going to be the best mix of approaches and therapies. So I'm sure there was a fair amount of trial and error, but you don't want to think about it that way. So
There really, you know, I can't say there was a lot of trial and error. I think that we just got better at determining more precision.
And how did you
so I'll tell you what happened.
How did you start?
Before the internet. I was raised to be an intellectual skeptic. And so I went to the library. I'm going to check out, well, what if you make these dietary changes? And there was all sorts of information about whole foods diets or traditional diets of very healthy cultures and populations. And then I realized, you know, Penny, you could spend forever looking for the final proof, but nobody ever died eating broccoli. So I said...
That we know of.
Yes, that we know of. I don't know that energy levels increase if people, you know, eat sugary donuts all day. In fact, I think it's problematic. So I thought, well, okay, let's check it out. And that's where I began. But Keith had already started too then. And
he was driven there by his own experience with the ulcers, right? And not being satisfied with the answers he was getting from his own discipline, essentially.
Correct. And he was a little nervous about that, you know, because he's in the midst of training. But he obviously experienced not only relief of a very painful ulcerating condition, but he discovered one day, and the only reason I'm laughing is because there was a poor woman in her hospital bed. He was talking to a patient, and he noticed in her chart the word migraines. And Keith had had migraines from the time he was very young, almost every other week. And his migraines were gone. So that was an astonishing thing.
And he realized it at that moment, talking to that patient, right?
Yes, yeah, exactly. And of course, she was a bit startled because he was astonished. She thought, is there something wrong here? But no. So I think that it was an experience, and it was more than just subjective. There were certain measurable changes.
And he had primarily changed his diet, changed things in his lifestyle in order to bring about this change.
And it's not just diet. And the neat thing, though, is diet and appropriate physical activity. If someone is undergoing treatment for chemotherapy, for cancer, let's say, and it used to be that the recommendations of doctors was during chemo, just go home and be sedentary, lie down, don't do anything. And we know now that, yes, you have to adjust levels of activity, but remaining physically active during treatment can diminish toxicity and side effects considerably.
Well, that's not surprising. I mean, in my own experiences with the medical establishment is such that we know that there's been tremendous change in thinking about when patients, just from surgery or whatever other treatment, should get up and start moving again.
Yes.
And it used to be, a week of bed rest after cataract surgery.
Right.
But now the idea is whatever it's happened to you, get you up and moving as soon as possible. It's
even
the same idea.
Major
right?
surgery, right?
Yes, even major ones.
But this actually can tend to offset, as I say, some of the side effects. And there's some increasing literature, scientific literature, suggesting it may enhance benefits of treatment. Then the other aspect is we do have supplements. We have a whole research team, a small research team that works with us. And going back to why did we get involved in supplements? Well,
And what is a supplement?
okay,
briefly,
supplemental compounds. Like people do certain, it's more than just multivitamins and so forth. There's a lot of evidence. It started proliferating way before the internet. And I started to tell a story about, I think it was like the middle of the 80s. There was information that said if you combine this compound, say with this treatment or with this particular health issue, you may see certain benefits, and they don't have the unwanted side effects of more potent drugs. And they're known as what is polytropic. In other words, they can hit many different targets at once, not with the potency. It's not
of
like
a target drug, but
yes.
they're
In other words,
helpful,
it's not like taking an antibiotic and curing an infection, a bacterial infection, but there are benefits that have been measured. So I only was sort of smiling earlier and saying there are these supplemental compounds, and a man walked in, and I think it was 85, just a kind of jovial guy with a huge tackle box of supplements, and it was before the internet. So the only thing I remember is I think he had his cousin or a neighbor that had suggested, and that was the kitchen sink approach.
He took everything he could imagine.
Everything. If they recommended it for who knows what, he was taking it because he was trying to cover all his bases. But there were two problems with that. One is there a problematic interaction between what he's doing and maybe some treatment or medicines he's taking? But the other thing is we could not stay on top of the actually commercially available supplements. There are many very, very good ones, but also many that we recognized had shown more thought going into the design of the label than the ingredients in the bottle. So in good conscience, we could not just say, just go out and buy anything. So we did start to formulate our own, and there was a reason for that too. There's a whole line of supposedly support supplements for oncology, for cancer patients. And one of the multis had, I can't remember, in excess, well, yes, multivitamin, I'm sorry, thank you for making that clear, had copper in it. And copper is what is known as an angiogenic promoter, meaning it promotes vascularization of new tumors. And
which would be bad. They're growing new veins,
we don't
they're
want to
getting
do
more
that.
blood supply.
Yeah,
right?
no, we don't want to feed new tumors. And we get copper, what we need, from foods, but we certainly don't need to give a booster dose to somebody. So we went back and reformulated what we were doing. This goes way back. And then we also go to, we have people produce our supplements. We don't have any production facility, but we go and check the quality, the standards, and make sure it's not being produced in somebody's garage, for instance.
Right. So you visit the premises where they're actually making
Absolutely.
this
We
stuff.
do site visits. And we actually have a third-party lab that often does some testing to make sure that what's in it is what we intend. And so we can recommend those in good conscience. There are certain supplements to take. There are certain drugs that are cardiotoxic, meaning have ill effects on heart functioning. And there's something called CoQ10, and if it's produced in the right way, it can really mitigate some of those problems. So there's a whole series of things that we do and recommend, but it has to be individualized.
So let me switch from the supplements, the things that you want people to take, to
Yes.
some of the things that you don't want people to take. And the
Okay.
one that comes first to mind is sugar.
Oh,
And I know there's been more research. In fact, I, some weeks ago, read about a physician who looked at it and said, when you look at all the negative effects of sugar, I can't understand why it's not a controlled substance.
there are many commentaries to the same, but there are also some people, and I have to tell you about an example that went on for one of our patients, many professionals who think it's not that relevant. And I can surmise many reasons for that, but I don't want to take up too much time doing it. But one of our patients, a relatively young man, and I won't mention the hospital where he was being treated, but he walked out of an infusion room and there was this huge tray of sugary donuts. So he asked his oncologist, is it okay if I have some of those? And
Now, this is a fellow being treated for cancer, right?
Yes.
And
So
Yeah.
the oncologist said, sure, you can have a whole sugar donut diet. Just make sure you get enough calories in a day. Now, he essentially fired that oncologist, and he did come to us. And with good results, I'm pleased to say, I mean, it's not 100%, but we really have very, very good results through the years, or I couldn't go back to work every day. Another topic. But at any rate, it doesn't make sense. It's
No.
not that sugar causes cancer. Let me be really clear about that. It's just that it's one factor in a whole constellation of food factors and a larger constellation of factors that really affect health. And what happens is there are certain scans that cancer patients go and have to see whether they're responding, say, to chemotherapy. And often they're given a sugary drink. Why are they given a sugary drink? Because those cancer cells are sugar guzzlers. And so they will just guzzle up that sugar in the drink and then light up on the scan. So you see where the active cancer cells are. So you would think that the doctors would say,
gee,
now wait a minute.
cancer cells love sugar.
Yeah.
There's a connection here.
So it baffles me. But anyway, there are many things that baffle me, so let's not go off in that tangent.
So let me ask you about the research that the Block Center does and the kind of results that you see. Why, maybe you can't, maybe there's no answer to this question, but why is it that mainstream medicine hasn't seen this? Because medicine sees itself, and I know having worked with doctors at various times in my life, that they see themselves as scientists and they're looking for evidence-based outcomes. And so it seems to me that the Block Center has a wealth of evidence that this works. So what's the disconnect here?
Well, let me talk about the evidence that we have, because we do have a published study that shows really remarkable survival data, breast cancer patients. But we don't have a randomized controlled trial showing that. This is a retrospective study. We excluded nobody. I said to Keith, if there was such a thing as a stage 5 breast cancer, we had those women in our study, and one actually came in recently. She had severe liver metastases. I mean, she had lesions all through her liver. That was, I don't know, 12 more years ago, and she's back working as a nurse and lots of good things. And that's not across the board. I'm not going to play Pollyanna with you. But, and so it was an important study we did, and the reason we did it, and we funded the study, was because we had witnessed many good results, but those are considered anecdotal. And so to be intellectually honest, we decided we better look at our data. So we did, and we did that study. It's published. We have a study on prostate cancer. We have a small cohort with colon cancer. We have, and we're collecting data on others. I didn't mention one other thing, though, that's part of this synergy, the biobehavioral component.
And what is biobehavior?
Biobehavioral is really how, there's so many different aspects to this program. It's what I used to call mind-spirit, but people used to trip over that.
I think that's too new age, it's too out there.
Yeah, and also people thought maybe we were selling some spiritual or religious practice, or no, we were just respecting it in people, because there is at Harvard, as you know, that was initiated by Herbert Benson, something called the Mind-Body School of Medicine in Harvard Medical School. But it forgets the human spirit, and there were surveys saying from people who were dealing with different kinds of health issues who acknowledged that their own personal spiritual and or religious practices had an impact on their health and well-being. So, and they wanted to discuss it. Something like 76% or 67% wanted their doctors to at least be aware of it.
Or acknowledge that
this
it meant something to the patient.
Absolutely, and only 10% had. So in our questionnaire, before people come in, we ask them, give them the option. But getting back to it, I got away from that because what really is academically is biobehavioral. That meaning there are even simple relaxation techniques that in a Harvard study was shown if practiced that elicit what is known as a relaxation response, which is the antithesis to the stress, the fight or flight response. If they practiced it once a day and it was on an average of 17.5 minutes during this 8-week study, for people who had never practiced any simple techniques to create relaxation.
Be like a meditation kind of thing to
well,
relax.
Relaxed breathing. There are many techniques, progressive muscle relaxation.
Okay.
But anyway, those who practiced it once a day during the 8 weeks were able to produce a change in gene expression.
Meaning, gene expression,
meaning how, we have this predisposition, our genes give us a predisposition to certain diseases, for instance. But that's not what really matters in the end. What really matters is how do those genes behave in our bodies?
And that's the expression.
They're influenced by lifestyle, et cetera, and all these other things. So that changed. And that it produced this change in gene expression that tended to, for instance, inhibit certain cancer-promoting factors and enhance certain specific health-promoting factors. They looked at something like, I think it was 2,200 gene expressions on these heat maps. Don't ask. It's a major interpretation that I just have to read their interpretation. But it was very impressive. So there are many things that I consider, many things like a relaxation technique.
And that was out of Harvard Medical School?
Yes. Dusick was one of the key researchers on that. But anyway, if anybody wants to go and look. But I consider daily routine relaxation techniques, even without a cancer, to be as critical to our health as eating fresh vegetables instead of those sugary donuts all day.
Right.
And it should be as routine as brushing our teeth in the morning. I mean, we don't usually think about doing that. And it should be that routine because it yields so many health benefits.
So if we think about integrative as some of the key elements, it is, of course, the medical approach as well, chemotherapy in the case of many cancer patients. Diet, exercise, relaxation. Do you still...
Certain supplemental compounds.
Supplemental compounds. Do you still stress the spiritual side, to work with someone's faith
only
system?
To respect what somebody considers their source of strength or meaning, connection to something larger than daily hassles. It's only out of respect.
Well, and I know that your center also talks to patients about what's their support system, what are their friends, what are their family, right? And how is that going to help in the healing process, right?
Also associated with better survival. And there's just interesting research showing that, for instance, women who have a dependable support system, not numbers, but dependable, and daily relaxation techniques had lower VEGF, which is an acronym for vascular endothelial growth factor. It's a molecular factor. It's so neat. It's a molecular factor. When it's elevated, that's not good. It contributes to angiogenesis, more rapid metastases or spread of cancer. And these women with good social support and relaxation techniques had dramatically lower levels of VEGF, this molecular factor that's relevant to cancer and or health. So it's a reminder that yes, psychosocial well-being is interconnected even with our molecules. That's biobehavioral. But I want to say also, yes, we do treatment. But we have been searching and we use a more innovative approach to administering, say, chemotherapies. We have something called chronomodulated pumps. They are programmed using a calculus sine wave curve, mathematically calculated so that the actual infusion of the chemotherapy, using certain knowledge about the chemotherapy drug itself and the nature of certain cancers, sort of start out slow and step by step increase until a certain hour when it is understood from research that, say, the cancer cells are proliferating more rapidly, but the normal cells seem to be quiescent. So better capture, lower side effects. And then it step down, it therefore infuses following the circadian rhythms. Now the neat thing is we often send people home or to a hotel wherever they're sleeping, staying, with pumps that are about yay big in a little bag. And they get to be infused that way. They don't even have to wake up. We have one slide of one of our patients who's an avid rollerblader. And we used to be in Evanston. We're in Skokie now. But when we were in Evanston, she would put on her rollerblades and was being infused with her chemo while she was rollerblading along the lake behind Northwestern.
So
now, we didn't tell her to do that.
that was her way
It's
of
not part
taking
of
control of her own health care.
Well, but it allowed her to do that. So it is a different way of thinking of conventional treatment.
We only have a few minutes left in the show.
Well, you know, I can ramble.
But I think that it's a very good overview of the different components that make up integrative health. And I think what I hear from you and what I think is really important is that it's not an abandonment in any way of Western medicine.
Not at all.
It is very much centered on standard chemotherapy regimen or protocols, right? And it's the integration of these other factors into it that makes the Block Center's approach unique. Is that correct?
Yes, they're simultaneous and systematically combined. And they're all, every component, everything we're doing is based on the best available science. And that's right. So we'll attend the major conferences in oncology, like the American Society for Clinical Oncology. I think there are 30,000 people that were at McCormick Place annually for this. And we're looking at all the best new research in terms of targeted therapies, et cetera. But we're also looking at the research based on diet and everything else. And we go back to the drawing boards many times because there's new information, and sometimes it's contradictory. So to be honest, we've got to take a look at that. And so it's a continual process.
Feedback from what you see
Always.
actually happening in the clinic, reintegrate that into your own thinking,
Yes.
and try to practice something wherever those changes are dictated. Right?
Yes.
And
Live this way.
Oh, yes.
Yeah.
Set the example. Right.
Well, live this way because I can't read the research, write the research, make recommendations,
not
and run off and
internalize
be
it.
a fool. I got involved because I wanted to be healthy.
Right. You can't do all this and go off and eat cheeseburgers and donuts as your standard diet. Right?
Nope.
Well, believe it or not, we actually have already run out of time. So,
Do you want to mention the book, the Life Over
yes,
Cancer book?
please do. You and your husband Keith have a book
Yes,
out.
a book. It's called Life Over Cancer. And actually, almost like the first two-thirds of the book are about optimal health. But it is a map of how to follow or find an appropriate way to integrate these different components and at different points along this trajectory to health.
That'll do it. We have to wrap up. So, Penny, thank you so much for being here. It's been very informative.
It's been fun.
And I hope you'll come back and see us again.
I love it.
All right.
Really.
Thank you. And thank you for joining us once again on Public Perspective. I'm your host, Kevin McDermott. You can find us every Saturday night at 8 on Comcast Channel 19. And you can find us on the web at publicperspective.tv. So until next time, thank you and good night.